Hello, my name is Jennifer Andraguien Sandoya. The topic is Dapagliflozin in patients with heart failure and reduced ejection fraction. Definition: in patients with type 2 diabetes, inhibitors of sodium glucose cotransporter 2 SGLT2 reduce the risk of a first hospitalization for heart failure, possibly through glucose-independent mechanics. More data are needed regarding the effects of SGLT2 inhibitors in patients with established heart failure and a reduced ejection fraction regardless of the presence or absence of type 2 diabetes. Applications in medicine. Large clinical trials involving patients with type 2 diabetes have shown that inhibitors of sodium glucose cotransporter 2 reduce the risk of hospitalization for heart failure. Most patients in these trials did not have heart failure at baseline, so the benefit of treatment with and SGLT2 inhibitors largely reflected the prevention of incident heart failure.
Studies have shown that in patients with type 2 diabetes, inhibition of the sodium glucose cotransporter 2, or SGLT2, reduces the risk of hospitalization due to heart failure. The mechanism by which this occurs is not yet understood. It's been hypothesized that SGLT2 inhibition may prevent heart failure complications, even in the absence of diabetes. In this multicenter randomized placebo-controlled trial, 4,744 patients with New York Heart Association class 2 to 4 heart failure and an ejection fraction of 40% or less were randomized to receive either dapagliflozin or placebo in addition to standard heart failure therapy. Randomization was stratified by the co-diagnosis of type 2 diabetes. The primary outcome was a composite of a first episode of worsening heart failure or cardiovascular death. Over an 18.2-month median follow-up, the primary outcome occurred in 16.3% of the patients receiving dapagliflozin, as compared with 21.2% of those receiving placebo. The findings were similar in patients with or without diabetes. The rates of adverse events were not significantly different between the two study groups, with volume depletion and renal dysfunction being the most common. The authors conclude that in patients with heart failure and reduced ejection fraction, dapagliflozin reduced the risk of worsening heart failure or cardiovascular death, even in patients without diabetes. Full trial results are available at nejm.org. Studies have shown that in patients with type 2 diabetes, inhibition of the sodium glucose cotransporter 2, or SGLT2, reduces the risk of hospitalization due to heart failure. The mechanism by which this occurs is not yet understood. It's been hypothesized that SGLT2 inhibition may prevent multi-center randomized placebo-controlled trial, 4,744 patients with New York heart failure and an ejection fraction of 40% or less, dapagliflozin or placebo, in addition to standard heart failure. Randomization was stratifiagnosis. The primary outcome was a episode of worsening heart failure or cardiovascular 18.2-month follow-up. The primary outcome occurs since receiving dapagliflozin, as compared with 21.2% diabetes. The rates of adverse events were not significantly different common. The authors concluded that in patients with definitely reduced the risk of worsening heart.org.
Pros and cons. Pros: the principal are SGLT2 inhibitors improve ventricular loading in conditions. SGLT2 inhibitors improve cardiac metabolism and bioenergetics. Cons: the main cons: hypoglycemia, renal dysfunction, volume depletion, diabetes, ketoacidosis was more common with dapagliflozin.
The benefits of dapagliflozin were identical in patients with and without diabetes, and even more so among the patients without diabetes. The benefits of dapagliflozin were consistent right across the spectrum of glycated hemoglobin. So even patients with a completely normal hemoglobin A1C got as much benefit as other patients. And clearly that questions the idea that in heart failure this is just about lowering glucose. And in fact, the patients without diabetes randomized to dapagliflozin had no reduction in hemoglobin A1C either, again questioning the benefits in heart failure just being about reducing glucose. So the alternative possibilities are that these agents do have, at least in the short term, a diuretic effect. That might be beneficial, but it's unlikely to be the whole explanation. These drugs do protect the kidneys, do slow the progressive deterioration in renal function that we see in patients with heart failure, and we've reported that with dapagliflozin, both in patients with and without diabetes. And then I think the third idea, at least, is that these drugs might have beneficial effects on the heart. Now, these are largely still in human beings hypotheses, but probably the two major ones are firstly that these drugs might improve myocardial energetics, make the heart more metabolically efficient, and in that way work better. One reason why that might be is because they increase the production of ketones, and you can think of ketones in a very simplistic way as a super fuel for the heart that are more metabolically efficient. And then the other explanation, but again very hypothetical and experimental, is that SGLT2 inhibitors might interact with what's called the sodium hydrogen exchanger on heart muscle cells, cardiomyocytes, and by reducing intracellular sodium might, for example, reduce the risk of sudden death. But we don't have any firm human evidence for that. It's a speculative mechanism. Dapagliflozin has two key roles when it comes to thinking about heart failure. The first is we have very strong evidence that dapagliflozin and the whole SGLT2 inhibitor family reduce the risk of incident heart failure. So if you've got type 2 diabetes, one of the major risks you face is developing heart failure, and dapagliflozin, like other SGLT2 inhibitors, unequivocally reduces that risk substantially. What's new is that we now know that dapagliflozin is also a treatment for established heart failure. So moving from prevention to treatment, we can treat patients with heart failure both with and without type 2 diabetes.
Also applying Ecuador. Dapagliflozin reduces the combined risk of death from cardiovascular causes and hospitalization for heart failure in patients with type 2 diabetes mellitus with and without kidney disease.
So we designed the DAPA-HF trial to test the hypothesis that the glucose-lowering SGLT2 inhibitor dapagliflozin might be of benefit in patients with heart failure and reduced ejection fraction when added to conventional therapy. And we designed the trial to see whether that was the case in patients with diabetes and in patients without diabetes. The latter constituted 55% of all of our patients. And we found that dapagliflozin reduced morbidity and mortality and improved symptoms overall and individually in patients with diabetes and also in HFrEF patients who did not have diabetes. In addition to that, dapagliflozin was very well tolerated compared to placebo, and in patients without diabetes, we saw no evidence of hypoglycemia. We saw no cases of diabetic ketoacidosis.
Conclusion. SGLT2 inhibitors have emerged as powerful pharmacological tools in the prevention of heart failure with the suggestion that unlike with other glucose-lowering agents, this benefit may be observed across the spectrum of people with type 2 diabetes with and without established cardiovascular disease. Thanks.